So, hello friends. My next topic is road traffic accident injuries. Injuries caused during road traffic accident. In these, we'll discuss the motorcyclist injuries. If you are a motorcyclist and there's a fracture, this is known as motorcyclist injuries. Number 2, pedestrian injuries. Pedestrian injuries. If you are walking and there is an accident, these are known as pedestrian injuries. Or vehicles injuries. Vehicles injuries. These are common injuries in road traffic accident. Now, my dear friend, these injuries depends on two things. Number 1, speed of the vehicle, and second, the point of impact. The speed of the vehicle and point of impact. What is the speed of vehicle and point of impact? So these are two criteria. The injuries, the nature of injuries, the severity of injuries, all this depends. Okay. Now first I'll discuss the motorcyclist injuries. Motorcyclist injuries. I told you in the regional injuries topic, it can cause motorcyclist fracture. What is motorcyclist fracture? It is a fracture of base of skull. It's a fracture of base of skull. And I classified motorcyclist fracture in few types, but motorcyclist fracture is type 1 hinge fracture. It is a type 1 hinge fracture. Now you can see this is base of skull, and my dear friend, I told you in the regional injury class, the motorcyclist fracture is the red line. It is the red line. Red line, which is starting from the petrous side, one side of the petrous ridge. Then it is going to the sella turcica. Then it is going to the another side, which is a petrous ridge. So this is known as motorcyclist fracture. Fracture, hinge type 1. Hinge type 1. It divides skull in anterior half. This is anterior half. And this is posterior half. Anterior half and posterior half. So this I discuss as a motorcyclist fracture. It's a hinge type 1 fracture. It is starting from the petrous ridge, going to the sella turcica and going to another side of the petrous ridge. So it is a side by side fracture. It is a side by side fracture. Means force comes from one side and going to other side. It is known as side by side fracture. So motorcyclist fracture is a hinge type 1 fracture which divides base of skull in anterior half and posterior half. This is known as motorcyclist fracture. हाँ, other fracture of the base of skull मैंने already आपको बताया था. Other fracture of the base of skull, yes, it is type 2, and this one which is in coronal plane, it is type 3. But motorcyclist fracture is type 1 hinge fracture of the base of skull. It is type 1 fracture of the base of skull. Now, my dear friend, in motorcycle, those people who are riding motorcycle, sometimes what happens, there's a word which is known as tailgating. Friends, tailgating is also known as underrunning. Tailgating is also known as underrunning. As the name suggests, running, underrunning. It is running into large vehicle or heavy vehicle. The backside of the large vehicle or heavy vehicle. So I am giving example. See, this is a truck. Yes, my dear friend. If any motorcycle or even you can write down car that running into or running behind the large or heavy vehicle and crushed. Rams. We can use a word rams inside or behind this or crushed. So this is known as underrunning, tailgating. My dear friend, in underrunning there are many injuries. The most common injury is head injury. The most common injury is head injury. The head is crushed. Head is crushed. And even sometime it can lead decapitation. Even it can lead decapitation, removal of the head. It can lead the injury of the face. Yes, my dear friend. An injury of the front part of the body, face, chest, trauma. So it can be the injury of the face, chest, abdomen. These are the crushing injury where you are running behind the large or heavy vehicle. This is known as tailgating, or it is also known as underrunning injuries. It is large or heavy vehicle कि आप नीचे crush हो जाओगे. This is known as tailgating. So these are two common injury which can be seen in motorcyclists if they get the fracture, motorcyclist fracture, and tailgating आप नीचे जाके crush हो जाओगे. Underrunning injuries. Okay, so tailgating is also known as underrunning injuries. These are two things you have to remember: motorcyclist fracture and tailgating. Okay. Now I am coming to a very, very important topic: pedestrian injury. What is pedestrian injury? You are walking or standing, then you get accident. This is known as pedestrian injury. Very, very simple, sir. Now, pedestrian injury I can classify in three types of injury. Number one, primary impact injury. Primary impact injury. It is the first contact, as you can see in the diagram. Yes, as you can see in the diagram, this is the first impact. This is known as primary impact injury. The first impact of the vehicle to the body. This is the first contact. It is known as primary impact injury. The most common site affected is leg. Okay. Second is secondary impact injury. Doctor, secondary impact injury is the contact or hitting by same vehicle, but it is second contact. It is known as secondary impact. So what will happen, sir? As you can see, there will be injuries. As you can see, there will be the injuries, and you are going over the vehicle. This is known as secondary impact. Second contact. Now I am coming to tertiary impact injuries. Tertiary impact injuries are also known as secondary injuries. Tertiary impact injuries are known as secondary injuries. These are also known as secondary injury. Now, Dr. Sahab, primary impact is the first contact. Secondary impact, same vehicle, second contact. Now you are thrown on the road or any other object. So it is impact by any other object. This object could be road. ये road भी हो सकता है. This object could be the, like you can say, divider. This object could be a tree. And this object could be some other vehicle. कोई दूसरा vehicle भी हो सकता है. Like उधर से truck आ रहा है. Some truck is coming from the other side. It can be this one also. So it is by some other object other than the same vehicle. First same vehicle, second same vehicle. Tertiary impact is by some other object other than the same vehicle. And tertiary impact is also known as secondary injuries. So if you are thrown and hitting the road, this is known as tertiary impact injury. As I told you, tertiary impact injuries are also known as secondary injury, not secondary impact. Secondary impact में गलती मत करना. Primary impact, secondary impact, and secondary injury. Secondary injuries are tertiary impact. Now, sir, we'll discuss primary impact injury. As I told you, the first contact with the vehicle. Sir, mostly the bumper part of the vehicle produces this injury. That's why most common injuries are bumper injuries, because bumper part hits your body. Now, what are the injuries on the body by bumper? What are the injuries on the body? Number one, it could be abrasion. Number two, it could be contusion. Number three, it could be some kind of laceration. And the last but not the least, very, very important, some fractures. These are bumper producing injury. Now, my dear friend, most of the time what happens? See, as I told you, what is the most common site? The most common site is leg. So if you are adult, my dear friend, there will be bumper fracture. What is the meaning of bumper fracture? Bumper producing fracture. This is known as bumper fracture. Bumper fracture is a fracture of tibia bone. Bumper fracture is a fracture of tibia bone, and it is the fracture of plateau. plateau of the tibia. Tibia की आगे की surface होती है the anterior surface. Plateau of the tibia mainly on the lateral side. So this is known as bumper fracture. So most of the time we have bumper fracture. Bumper fracture is a tibia fracture. It is wedge-shaped fracture or triangular fracture. Wedge-shaped fracture or triangular fracture. The fracture may be some other fracture also. If it is not tibia, some other fracture may be also. So apart from tibia, there can be fracture of fibula, and sometimes very rarely it could be femur. But most common fracture is bumper fracture, fracture of tibia bone. Tibia bone, lateral side, it's a bumper fracture. You can see this picture, sir. This is a wedge-shaped fracture. As you can see, this is a wedge-shaped fracture, the triangular fracture. This is known as bumper fracture. But, sir, most common site, it is this one, tibial plateau. Tibial plateau. And my dear friend, the base and apex. Base and apex. The base is the point of impact. The base is the point of impact and the apex is direction. Apex is direction of car or any vehicle. So this apex denotes the direction and base is the point of impact. This is known as bumper fracture. So mainly it's a fracture of tibia bone. As I told you, the base, this is a triangular. The base, what is the base? It is, as I told you, it is impact, the point of impact. It is the base. And apex is the direction of vehicle, direction of movement. Okay, so this is bumper fracture. My dear friend, in adult, the most common site is leg without any doubt. So there will be the tibial fracture, bumper fracture, all fracture will be there. Femur, fibula, these fracture will be there. But in children, my dear friend, children are in short stature. Children are in short stature. So in short stature, there can be fracture of femur also. Femur also. So this is a primary impact injury, the first impact by vehicle. This is bumper fracture. Bumper fracture is a wedge-shaped fracture of lateral plateau of tibia, lateral side. Now, my dear friend, if the bumper fracture is or bumper injuries are on back of the leg, that means the vehicle is coming from behind. Vehicle is coming from behind. Now, my dear friend, vehicle movement. Doctor, this is the situation. Okay, see, this is the back side. This is the back side. Okay, so I'm talking about if the vehicle is coming from behind, the injury will be on the back of the leg. Now, if vehicle movement is from right to left or vehicle movement is from left to right, bumper injury, where you will find the bumper injuries. Okay, if right to left, there will be the injuries. There will be injuries on the lateral aspect of right side of leg. Lateral aspect of right side of the leg. इसका मतलब पीछे से आ रहा है. It is right to left. Right to left. So it is lateral aspect of right side. And if it is left to right, it is lateral aspect of left side leg. Left side leg. So again, I'm revising, my dear friend. If the vehicle is moving from right to left, it is lateral aspect of right leg. And if vehicle is moving from left to right, it is lateral aspect of left leg. Left leg. So just keep this in mind. Yes, two important words. Now, if the injuries are on the front of the leg, that means vehicle is coming from the front side. भाई अगर front leg पे है, front side पे है, तो that is vehicle is coming from the front side. If the injuries, bumper injuries are on same level of the leg, same level on this leg, same level on this leg, that means the person or pedestrian was standing. But if it is different level of the leg, that means the person was either running or walking. Yes. So again, I'm revising, my dear friend, bumper injuries Back of the leg, that means vehicle was coming from behind. Yes. And now vehicle is coming from behind. Okay. In this situation, vehicle is moving from right to left. It is on the right leg lateral aspect. And vehicle is moving left to right. That means lateral aspect of the left leg. Very, very important. Front of the leg, it means the vehicle is coming from the front side, standing, same level of the leg, 2 injuries, different running or walking. Very, very important. Now, my dear friend, height of the injuries. Most of the time, it can be same height. It means same height means the height of the bumper and the injuries will be on same height. Same height. And yes or no, my dear friend? Now, if vehicle is accelerating, means the increasing in the speed, it can be a higher height compared to the normal. And if vehicle is using brakes, if it is brakes, it is bended down, so it can be a lower height bumper injuries. So by this you can remember the speed, the sight, the right to left movement, the left to right movement, whether it is coming from front or behind. This is a very, very important topic, primary impact injuries. Bumper fracture is a vase-shaped fracture of anterior plateau of tibia. It's a lateral plateau. Okay, it is anterior. Now, the second injury, secondary injury or secondary impact injury, as I told you, it is caused by second impact. So, as I told you, it is caused by second contact of the same vehicle. Second contact. Now, how would you get the second contact? Either you will go to the bonnet. Yes. Either you will hit the bonnet or you will hit the windshield. But my dear friend, you are hitting the bonnet or windshield, there will be multiple injuries. These injuries, the most common type of these injuries are head injuries. Head is hitting. Head injuries. Apart from head injury, there can be cervical injuries, cervical fracture or cervical injuries. Yes. And there can be skeletal fracture, skeletal injury. These all injuries are possible in second impact. So there can be abrasion, contusion or laceration. Most common type of injuries, head injury. So this is secondary impact. You are going over the vehicle. This is secondary impact, a very, very potential MCQ. So now I am coming to the third one, my dear friend, tertiary impact. I already discussed, my dear friend, tertiary impact is also known as secondary injuries. It is hitting with some other object. This object could be road, ground. So probably you are hitting the road or ground. Yes. Or you are dragging. Your body is dragged. आप घसीटे गए हो. If your body is dragged, it is a tertiary impact injury. Dragging of the body or hitting the ground, it is a tertiary impact injury. So I told you, it is caused by either hitting the road or by dragging. By dragging. My dear friend, what are the possible injuries in this? My dear friend, what are the possible injuries in this? Number one, it is head injury. Number two, skeletal fracture or skeletal injuries. Yes, skeletal fracture or skeletal injury. You can write down skeletal fracture. Yes. Now, my dear friend, you can get a question. Multiple grazed abrasion and laceration are very, very important. And here it is due to because you are being dragged on the road. अब आप क्या होगा, रोड पे घसीटे गए हो. If you are being dragged on the road, multiple abrasion and lacerations are possibility. So again, I am revising. These are produced by road, by dragging over the road, and most common type is head injury, skeletal injury. But sir, if you find multiple grazed abrasion or laceration, definitely it is because you are being dragged. So these are three possible injuries. Now, my dear friend, in tertiary impact injury, I can classify the injury in two categories. Number one, roll on or roll over injury. You can write down roll on or roll over injuries. And my dear friend, what is the meaning of roll on? The body is rolled on. It is seen by the vehicle which is having low chassis. It is seen by the vehicle which is low chassis. Example is like car. The small car has a low chassis, so your body will be rolled on. Your body will be rolled on. It's not a run over, it's a rolled on. Okay. So my dear friend, most characteristic will be grazed abrasion, because while you are rolling on, while you are rolling on, there will be grazed abrasion which is seen on circumference. Grazed abrasion which is seen on circumference. Circumference means all circumference will show the grazed abrasion. Okay, multiple grazed abrasion. Fractures of the bone, very, very important, my dear friend. Fractures of the bone. Now, so grazed abrasion on the circumference of the body and the fracture of the bone, the chassis will form the patterned abrasion. The chassis will form the patterned abrasion. Okay, it is a low chassis car. Hot exhaust, the heat is exhausted. This will cause the burning of the skin. The burning of the skin can be seen, and the grease material on the body will form the grease stain. The grease material of the car that will form grease stain. So these are the common when it is a rollover injury or roll-on injuries. It means it is not run over. It is the body is rolled on by the vehicle. ऐसा vehicle जिसकी chassis low हो. Chassis low. Okay. Now I am coming to the run over injury. My dear friend, first question. Run over injuries are caused by those vehicle, heavy vehicle, where chassis is high. Where chassis is high. Example, the heavy truck, lorry, heavy truck, lorry. These causes run over injuries. Because the chassis is high, higher from the ground. Chassis is low, lower from the ground, higher from the ground. This will cause the run over injury. Means the vehicle will run over your body. Rolled on. You are rolling on and the vehicle is rolling on. Run over, that vehicle is running over your body. That is when the chassis is high, like truck or lorry, heavy lorry. Now, my dear friend, the most specific, ध्यान से सुनना, the most specific mark are tire mark. Very, very potential. Dr. Saab, tire mark are actually, I already discussed, these are the example of patterned abrasion. So, my dear friend, there will be tire mark. Tire mark are example of patterned abrasion. Or because it is running over of the vehicle, we can write down it is an example of patterned bruise also, intradermal bruise also, because of heavy object. Grazed abrasion, multiple grazed abrasion on the body. Multiple grazed abrasion on the body because of friction. So grazed abrasion, the mechanism is friction. The mechanism is friction. Now, my dear friend, separation of the tissue, tearing off, separation of the tissue, this is known as avulsion. That is shearing laceration. Shearing laceration. Separation or tearing of the tissue will be separated, there will be avulsion. Crushing injuries, my dear friend. Crushing of the head, crushing of the body, and crushing of the internal organ. This is known as crushing injuries. And my dear friend, the burning and blackening, same method I told you. The burning and blackening is because of heat or exhausted heat that will cause burning and blackening. And grease stain, these can be possible. But sir, again I am telling you, this is a run over injury. First I told you rolled over or rolled on injuries. Again I am telling you, if you have the low chassis low hai, your body will be rolled on. Body will be rolled on. Yes, this is rolled over. And if chassis is higher, bade heavy truck hai, lorry hai, your body will be run over. Run over injuries are by higher chassis. Okay, so just remember this one. So these are roll on injuries and run over injuries. Very, very important. Now, my dear friend, I am coming to the next category, car occupant injury. First of all, what are the injury which are possible in car occupant? Sir, in car occupant, the first occupant is driver. The first occupant is driver. The second is front seat passenger. front seat passenger. What are the injury in the driver and what are the injury in the front seat passenger? Now, first I'll discuss the car driver injuries. Car driver injuries. My dear friend, in car driver injury, the first is windshield injuries. Windshield, the glass. If the glass is broken, if the windshield glass is broken, actually, sir, after it is broken, it is a shattered glass. It is a shattered glass. The glass fragments or glass particle, which can be spherical or cubical. So this glass is shattered glass. The glass particle, glass fragment are spherical and cubical. What happens, sir? When I crushed in the glass, means my body has been crushed in the glass. I am a front seat car driver and my body is crushed or my body is pushed in the glass. So it is, you are ramming in the glass. You are thrown in the glass. So what will happen, sir? There will be sparrow feet mark by this glass particle. Sparrow feet mark by this glass particle. How the sparrow feet mark look like? It is just like a sparrow feet on the face. So sparrow feet mark, the most common site is on the face. What is sparrow feet mark? It is multiple small superficial punctate laceration. So again, I am telling you, my dear friend, because of the glass particle, when you are thrown in the glass, there will be windshield injury, and these injuries are sparrow feet mark. These are multiple small superficial punctate laceration, and it is not common when you are wearing seat belt. So it is not common because most of the time if you are wearing seat belt now, then it is not common. So my dear friend, what I discuss? I am discussing the car driver injuries. Yes, my dear friend. The first car driver injury is a windshield injury. It is by broken glass, which is a shattered glass, and you are thrown in the glass. Your face is thrown in the glass, ramming in the glass, crushing. So there will be multiple small superficial punctate laceration on the face. This is known as sparrow feet mark. So first is sparrow feet mark, but the sparrow feet mark is not common because we are putting seat belt. That's why this is not common. Second, my dear friend, if this glass particle, if these glass particles are broken and hit your body, hitting your face or body, these injuries on face or your body, this is known as dicing injury. देखो दोनों चीजें अलग है. First, you are crushing in the, you are thrown in the glass. Second, the glass particle coming on the face or the body. This is known as dicing injury. Both are different. Sparrow feet mark. Sparrow feet mark when you rams inside the glass. That is small multiple superficial punctate laceration. So first injury because of the windshield I discussed. Second injury, my dear friend, neck injury. My dear friend, neck injury, number one, it could be whiplash injury. Number two, it could be neck fracture. That is a cervical fracture. But sir, what is a whiplash injury? My dear friend, it is not a fracture. It is a soft tissue injury. It is a soft tissue injury. That is a whiplash injury. Soft tissue injury of the neck. Now what happens, sir? Neck injury. There is a violent neck movement. So what is the reason of the neck injury, my dear friend? The reason of the neck injury is violent neck movement. Okay. Now this violent neck movement produces whiplash injuries. What is whiplash injury? Number one type is acceleration. Number two type is deceleration. What is acceleration? When your speed is going up, then you hit someone, this is acceleration. What is deceleration? When your speed is already high, then your sudden stop, this is known as deceleration. Okay. Now, my dear friend, in acceleration, what happens? In acceleration, what happens? It is hyperextension of the neck. It is hyperextension of the neck followed by hyperflexion. Hyperextension of the neck followed by hyperflexion. This is acceleration injury. And what about the deceleration injury? It is hyperflexion of the neck followed by hyperextension. This is deceleration injury. So when you suddenly stop, what happens? First you go hyperflex, then hyperextension. This is deceleration. Now, my dear friend, more common and dangerous is hyperextension. If you get a question, which is more common and dangerous as the whiplash injury, the answer is hyperextension. My dear friend, in the whiplash injury, there will be contusion of the soft tissue, of cervical spinal area. And my dear friend, most common level is C5 to C6. Most common level. So soft tissue injury of cervical spinal area, a fatal contusion. Sometimes it becomes a very, very fatal contusion of the spinal cord. So my dear friend, this is an injury of spinal cord. This is soft tissue injury. And my dear friend, this is known as whiplash injury. And which is more dangerous or more common? The answer is hyperextension. This is more common. Neck injury can cause some cervical fracture also. That's a different thing. But whiplash injury. Now, sir, what is the most common site? Most common site is anterior longitudinal ligament. Anterior longitudinal ligament. That's a very, very important. You can see this is mainly a hyperextension. Yes, my dear friend. It is torn anterior longitudinal ligament and torn knuckle ligament of cervical spinal area. This is known as whiplash injury. And as I already told you, it's a soft tissue damage. In neck injury, there can be fracture of cervical vertebra. And most common site क्या बताइए? C5, C6. The most common site is C5, C6. So I have discussed two injury of car driver. Car driver number one injury was windshield. Car driver number one injuries was windshield. Number two injury are neck injury. Now I am coming to number three injury, my dear friend. Steering. Steering आपके car driver के पास होता है. ST for steering. It is ST for it's a sternum fracture. Yes, my dear friend. RI, it's a ribs fracture. Sternum fracture and rib fracture are very, very common. Very, very important. So what are the other sites? It can be fracture of elbow and your arm bones or forearm bones. Fracture of elbow and forearm bones, that's very common. Now, apart from this can involve other organ. But sir, a very, very important pattern bruise. Pattern bruise. What is the common site of the pattern bruise? Pattern bruise, the most common site, the most common site is chest. So the steering will form the pattern bruise on the chest. Organs involved are, a very, very potential word. Organs involved are lung, heart, and aorta. Lung, heart, and aorta, these are the common organs involved. So ST, steering, sternum, ribs, it's a fracture of elbow, forearm, and wrist. Fracture of elbow, forearm, and wrist steering. Okay. Pattern bruises on the chest and organs involved are lung, heart, and aorta. Very, very important. My dear friend, direct impact on aorta. This will cause the torsion force. Direct impact on aorta. This will cause torsion force. And my dear friend, this mechanism is torsion force. Which part of the aorta is involved? Because the steering is hitting the aorta. The part involved in aorta is isthmus. Isthmus. And my dear friend, very, very important. You can remember, sir, this is a ascending aorta. And this is a descending aorta. Yes. The isthmus is distal to, isthmus area is distal to subclavian artery. So this area which is the isthmus, which is distal to subclavian artery, this is involved. And it is descending aorta. This is ascending aorta. And there will be transverse fracture. There will be transverse fracture. So another very, very important word, this will be transverse fracture. So there will be transverse tear. So correct this. So isthmus is distal to, correct this, okay. This isthmus is distal to subclavian artery and there will be transverse tear. There will be transverse tear. Transverse tear in the intima of the isthmus. In the intima of the isthmus. And my dear friend, isthmus, this is known as ladder rung tear. This is just like a ladder pattern. This is known as ladder rung tear. It is isthmus is intima showing transverse tear. And my dear friend, this steering wheel, so there will be compression between. There will be compression between sternum, because in front part of the aorta you have sternum and in the back you have thoracic vertebra. In the back you have thoracic vertebra. So my dear friend, there is a compression between sternum and thoracic vertebra. This phenomena is known as osseous punch. This phenomena is known as osseous punch. But my dear friend, at least you have to remember the most common site is isthmus of the aorta. It is a transverse tear, horizontal tear in the intima of the blood vessels. That's a isthmus. Ladder rung tear, and it is a compression between sternum and thoracic vertebra. It is osseous punch. And my dear friend, you have to remember ladder rung tear, most common site is isthmus of aorta. It is isthmus of aorta. Very, very potential MC. Deceleration injury to the aorta. Deceleration injury to the aorta, because first I told you the direct impact on the aorta. The second is deceleration injury to the aorta. This causes stretching. This causes stretching or straining of the aorta. The mechanism is stretching and straining of the aorta. Here, the main force in direct impact is torsion force. And in deceleration injury, it is stretching or straining of the vessels. That is aorta. So there are two types of mechanism we have. Now, my dear friend, so I have discussed three things: steering wheel injury, yes, neck injuries, and windshield or broken glass injury. Okay. Now I am coming to the fourth one, seat belt injury. Seat belt injury I can classify in three categories. Number one, seat belt syndrome. It contains three things. So my dear friend, seat belt injury, there is a seat belt syndrome. Seat belt syndrome has three things: seat belt sign. Number two, intra-abdominal traumatic injury. Number three, vertebral injuries. What is seat belt sign? My dear friend, this is seat belt sign. Pattern bruise. So pattern bruise, this is seat belt sign. And my dear friend, if I'm a driver, the most common site is the right shoulder. It is starting from the right shoulder if I am a driver. So it is starting from the right shoulder, then it is going downwards to involve this. It is seat belt sign, a pattern bruise. My dear friend, intra-abdominal injuries. तो डॉक्टर साहब सीट बेल्ट सिंड्रोम में तीन चीजें होती है. नंबर वन, सीट बेल्ट साइन, which is a pattern bruise. In driver, it is on right side. Intra-abdominal injury, it is by deceleration and compression mechanism. The intra-abdominal injury is by dissolution because suddenly the vehicle stops and compression. What are the common organ? The most common site is mesentery. Most common site is mesentery. Then small intestine. Then spleen. And then liver. These are the most common site of intra-abdominal injury by seat belt. My dear friend, in small intestine, if you want to go in detail, the most common site is duodenojejunal flexure. ये क्वेश्चन आता है. The most common site is duodenojejunal flexure. The second is ileocecal junction. So duodenojejunal flexure and ileocecal junction. Now I am coming to, sir, vertebral injuries. Vertebral injury is caused by two mechanisms, distraction and compression. Vertebral injury is by two mechanisms, that is distraction and compression. If you are using lap belt means the belt only over the lap belt, there is a hyperflexion of spine. Hyperflexion of spine. And the most common site is lumbar vertebra. Hyperflexion of the spine, most common site is lumbar vertebra. Now this is the first mechanism. Now if you have distraction, due to distraction is like it's a loosening of the joint, or you can say separation of the joint. It's a separation of the joint. So distraction on the posterior side and compression on the anterior side, it causes postero-anterior fracture. Distraction on the posterior side of the vertebra and compression in the anterior side of the vertebra, it causes postero-anterior fracture. And my dear friend, this postero-anterior fracture of the lumbar vertebra, this is known as chance fracture, or it is also known as fulcrum fracture. Distraction on the posterior side, compression on the anterior side, it causes postero-anterior fracture of the vertebral body. It is a fracture of vertebral body. It is known as chance fracture or fulcrum fracture. So what are the seatbelt syndrome? Number one, seatbelt sign, that is a pattern bruise, intra-abdominal trauma, as I told you, mesentery and everything, and vertebral injury. So my dear friends, यहाँ पे तीन बातें याद रखना. Seat belt syndrome, तीन चीजें. Number one is seat belt sign, a pattern bruise. Number two, the intra-abdominal injury, the injury involved, the most common side is mesentery. Other side are small intestine, spleen and liver. And the third foremost, it's a chance fracture, a hyperflexion of this. This is a transverse fracture. So my dear friend, chance fracture is a postero-anterior fracture of the vertebral body. It is a transverse fracture. It is a transverse fracture. Transverse fracture line is a chance fracture. So these three things combined are known as seat belt syndrome. Now, as you can see, it is bruise starting from the right shoulder, then it is in driver, it will be seen in the right shoulder. Okay, then it is going in this direction. Yes, we have already discussed this one. This is the pattern bruise. Now, my dear friend, if you are not driver, you are front seat passenger, you will have all the injuries same which we have seen in the driver. वो injuries होगी सारी. There will be windshield injury, the sparrow foot mark, or I told you the dicing injuries. Second, there will be whiplash injury, the cervical injuries, the spinal cord injury, the soft tissue in the injury of the spinal cord. Yes, there will be seat belt injury. But my dear friend, in this, the only difference would be because you are a front seat passenger of a car. So it will start from the left shoulder. The pattern bruise will start from the left shoulder. Very, very potential MCQ. It will start from the left shoulder. It will go in this manner. Other will be seen. Dashboard injury, I'll discuss. It means, sir, one injury is missing in the front seat passenger. Anyone who can tell me? Yes, steering injury is missing. No steering wheel injuries. No steering wheel injuries. Because there is no steering wheel. Okay, that's very, very important. Now, dashboard injury. What happens, sir? Like, see, you are sitting. This is your hip. You are sitting in this position. So, what is this position? Sir, knees are flexed. Knees are flexed and your hip is also flexed. So where is the dashboard? In front of you, in front part of the leg. This is the dashboard. So this dashboard hit the flexed knee. This dashboard hit the flexed knee. So there are 3 P. Number 1, patella fracture. Number 2, posterior cruciate ligament injury. Patella fracture, posterior cruciate ligament injury. And the third, which is very, very important, sir, posterior dislocation of hip. Posterior dislocation of hip. These are 3 dashboard injury. All 3 are P. Patella fracture, posterior cruciate ligament injury, posterior dislocation of the hip. This is known as posterior dislocation of hip. This is also known as dashboard injury or dashboard dislocation. Very, very important. And most common nerve to be involved, it is sciatic nerve. It is sciatic nerve is the most common nerve to be involved in posterior dislocation of hip joint. Now, why most common injury is posterior cruciate ligament? Most common is posterior cruciate ligament. Why not anterior cruciate ligament? The reason is, in this position, anterior cruciate ligament is relaxed and posterior cruciate ligament is taut. So there are chances of posterior cruciate ligament injuries more. So anterior cruciate ligament is relaxed. That's why the posterior cruciate ligament injuries are more common, because it is taut. Because it is taut. So just remember 3P, patella fracture. Sometime femur fracture is also seen, but most common is patella. P, posterior cruciate ligament injury. P, posterior dislocation of the hip that can injure the sciatic nerve. These are the common injury in the dashboard injury of the front seat passenger. Very, very important. Which injury is missing here? कौन सी injury नहीं होती? It's a steering wheel injuries are not seen. Why anterior cruciate ligament injury is less? It is relaxed, which is taut posterior cruciate ligament. And what is the dashboard injury? It's a PPP, patella fracture, P, posterior cruciate ligament, P, posterior dislocation of hip. What is the most common nerve injured? It's a sciatic nerve. So my dear friend, this is all about, we discussed the injury of motorcyclist, the injury of pedestrian, injury of the car occupant, injury of driver, injury of the front seat passenger. A very, very important topic. Just go through this. Good luck.